He said, I'm sorry, I have bad news. You have small B-cell lymphocytic lymphoma. Well, so I hear lymphoma and I just know that, yeah, it's cancer, right? And so I started crying and I asked him if I was going to die.
Nadia had been quite busy with her life, excelling in the academic domain and working on her master's thesis in English while handling the responsibilities of an administrator for a neighborhood church. Aside from her academic responsibilities and administrative duties, Nadia had been enjoying her hobbies of hula hooping, Zumba, writing, and photography, and all of this had been going smoothly for her until her body started to react, hitting her with painful symptoms that were not to be taken lightly at all. It was 2018 when hot flashes, painful itching, rashes, lumps, unbearable fatigue, and shocking pain started appearing as initial indications that Nadia's immune system was prone to danger. Nadia, who was going through these painful symptoms, started suspecting that something was indeed wrong. Yet, her suspicions were shot down by her family, friends, and even the doctors, who all thought that Nadia had gone crazy. The first of these symptoms were rashes on her lower legs and the welts and bumps that usually appeared at night, forcing Nadia to think that if it were bed bugs or other insects, why was no one else in the house getting these rashes? It took 2 years of irritating itching, spotty rashes, fatigue, headaches, neck pain, daytime hot flashes, and other irritating symptoms, along with a lump under her left arm and a distended abdomen, which finally forced her to confront her general physician. Nadia approached her general physician in July 2020 with a case of a lump under her left arm, which was not going away, after which the doctor sent her for a mammogram, an X-ray, and some blood tests. By this time, Nadia had been going through severe anxiety, as she was sure that something was indeed wrong. But her tests turned out to be normal, and the doctor just assumed that Nadia might have had an infection. Nadia, who was anxious, tried to tell her doctor of her symptoms aside from the lump, but the doctor ignored her, telling her off as an overly skeptical person before guiding her out of his office. Yet the anxiety was still there, alarming Nadia to take action before it was too late. Nadia, trying to overcome her anxiety, took a 2-week short vacation, and while going through her pictures on that vacation, she observed that something was wrong with her abdomen, which led her to resolve to approach different doctors and to make someone listen. Fortunately, a doctor recommended by her friend turned out to be a compassionate listener, an advocate who calmed her down. Nadia was relieved by her new doctor and told him everything about her anxiety and symptoms, after which the doctor conducted a physical exam and concluded that Nadia had swollen lymph nodes all over her body and ordered some additional blood tests that had not been done before sending her to the urgent medical assessment. The doctor took the time to hear all of Nadia's problems and supported her when she needed it the most. He also mentioned that she could have Lyme disease and autoimmune disease, or, in the worst-case scenario, lymphoma, but he assured her that he would follow her with a checkup later. Nadia specifically remembered the time that her doctor even called her later that night to check up on how she was doing, and he continued to do so through texts throughout her medical assessments. Surprisingly, these blood tests also came out fine, yet her doctor recommended her to another specialist for further confirmation. Following the advice, Nadia went to the urgent medical assessment clinic at the hospital in September, where she was going to meet an internist who was going to look at her symptoms and tell her about what was going on. However, the internist turned out to be an ignorant man who downright rejected Nadia's claim of having multiple swollen lymph nodes, which she had to counter by forcing him to do a physical checkup, after which the internist agreed to do some other blood tests. Nadia felt like she was being treated like a hypochondriac who was just wasting her time and the allotted resources. During these times, Nadia had also developed symptoms of lumps in her neck, choking, pain radiating from her neck into her collarbone, arms, elbows, and hands, pain in her lower left chest, abdomen burning, heat in her knees, night sweats, radiating chest pain, shortness of breath, and even heart palpitations and insomnia. And these were alone the symptoms that Nadia was not being a hypochondriac, but something was wrong with her. As the symptoms extended their influence on the body, Nadia, while at work one day, felt pain in her hips and could not stand up even if she wanted to. She rushed home and laid on the floor for a couple of hours due to unbearable pain before crawling into her bed. Nadia then consulted her primary doctor first thing in the morning of September 29, who observed that she had shingles and all of her symptoms were getting worse. After her CT scan in October, the internist called her once again, informing her that the radiologist who had observed her CT scan reported a mass of enlarged lymph nodes in her neck, armpits, and abdomens, and had ordered Nadia a biopsy for lymphoma protocol. Nadia, who had been anxious for 2 years and who had been regarded as a hypochondriac, finally felt relieved as she now proved herself that her suspicions were right all along. Yet, she still hoped it to be an autoimmune illness called sarcoidosis, as she did not want to have what she had suspected all along. Nadia then went for her needle biopsy to a professional who informed her that her lymph nodes were on the larger side but were not abnormal, hence suggesting to Nadia that core needle biopsy was not medically necessary. Agreeing with his suggestion, Nadia backed off her needle biopsy as she wanted to avoid it as much as possible. However, the general physician who followed her through texts and calls recommended she tell everything to her internist, as it was seriously important. Nadia, following his advice, informed her internist who had redirected her for a needle biopsy. The internist got angry with Nadia, claiming that he did not want to get in trouble if something had gone wrong. Worried about his medical practice instead of having genuine care for his patient, the internist desperately started pushing Nadia for a surgical biopsy, and Nadia, before her surgery, wanted to have a chance at a needle biopsy one more time. Nadia went to the same hospital 2 weeks later, where there was a different doctor this time who also suggested the same thing that had been suggested before. Irritated by this, Nadia desperately clung to her decision of having a core needle biopsy and asked the doctor to do what he had been told to do. After her core needle biopsy, Nadia was now up for her surgical one, which ended up taking a whole month before she got an appointment. During that time, her pain increased as she started getting night sweats. Her throat got so sore that she had a hard time swallowing, and her rash spread around her bottom and the top of her legs. When Nadia called her internist about her throat, he responded that he was not an ENT specialist and that she had an upper respiratory tract infection. Nadia then phoned him about her night sweats, and the answer was similar, as he told her that she needed a dermatologist. Nadia grew sicker, tired, and more annoyed by her illness day by day, as she was barely able to do anything properly. When the time came, Nadia rushed to the ENT specialist, who felt her lymph nodes, labeled them abnormal, and told Nadia that he was going to make an incision on her neck that could have been risky enough to cause her facial or shoulder paralysis. Made afraid by the fact, Nadia confirmed that the surgery was even important or not, and the specialist made it clear that it was extremely important. After the appointment, Nadia headed to her car and cried the entire way home, as she was afraid of the risks and helpless. Nadia was informed that she would be getting her surgery in January after 2 weeks of holidays, and she was barely able to function at that point, especially with everything happening during the pandemic. Nadia found herself isolated at home, communicating with her family through video calls, feeling terrified in her apartment, and coping with the anxiety of waiting for the surgery date, which was overwhelming for her. Fortunately, Nadia had a close sister whom she confided in frequently, along with her counselor, which also provided some relief. She would update him on everything happening, and he became instrumental in coaching her on how to communicate with doctors effectively. He encouraged Nadia to advocate for herself and insisted that she deserved to be heard. Nadia found her counselor's unwavering belief in her to be invaluable, as she understood the importance of having someone who believed in her when nobody did. He explained that individuals with mental health issues or anxiety are often dismissed by medical professionals, especially if anxiety is already presumed. Despite this, he empowered Nadia to persist and emphasized that her concerns were valid. Finally came the time of her surgery on January 8th, when Nadia went through the procedure hoping to wake up just fine, and fortunately, she did. She had avoided paralysis and now was recovering from the painful surgical cuts, but she was relieved that she had gone through the surgery safe and sound. But a danger was still there, hiding in her body. And then eventually came the bad news on January 15, when her internist called her in a serious tone and confirmed if she was home alone and whether she was sitting or not. Nadia eventually caught up to the tone and knew that something was wrong. And then her internist gave the news that Nadia had small B-cell lymphocytic lymphoma. Nadia burst into tears, knowing that she had been right all along, and maybe she had been too late in the diagnosis. Yet her internist assured her that she was not going to die and referred her to a hematologist at the BC Cancer Agency. The internist told Nadia that he had made an urgent appointment with the hematologist on her behalf and that she would be called as soon as possible. Finally, it was time that Nadia had been listened to, her symptoms had been taken seriously, and was sent for the appropriate treatment plan. As we conclude Nadia's story, we have come to learn that a sick person needs emotional support rather than destructive criticism, which can hurt beyond repair. Nadia's battle is proof of how effective your emotional support can be towards those who are fighting for their lives. And for those who are fighting these complications, keep fighting and listening to your body rather than believing somebody else. You know your body better than anyone else, and blind trust in your doctor's malpractice can cost you your life.